Unicorn Battles, Anna. Anna, hi.
Hi, Marina. Thank you for introducing me, and I'm really glad to be here with you. And thanks to our sponsors. This battle is happening in Europe. Our platinum sponsor, Network VC California Seed Fund. Our golden sponsor, Silicon Valley Syndicate Club. Our silver sponsor is Sci-Fi Acceleration Program. And our event is the world's largest startup pitch contest in 2020 by geography, and the number of the events already held this year. And the winner of today's online unicorn battle in Europe will participate in Unicorn Cup finals, presenting the industry of health tech from Europe on behalf of European and Israeli startups, November 20th, save the date. And besides the best startups from all over the world pitching live, we'll have Startups Expo, where startups from all over the world will expose their innovations, showcase themselves to famous VCs, to top angel investors. So take your chance, be with us in this great happening. This is the second season of our Unicorn Cup, and it was dedicated to 4 industries. We looked into 125 countries of the world, discovered amazing startups in health tech, fintech, AI, and general. We believe in our company that all the best things come into life only when you have right people by your side. So partners and sponsors are welcome to join us for the next season. It will be even more exciting. So if you are interested, please contact me, contact our girls, and we will talk it some more. I would like to introduce you to our ecosystem. We are a smart ecosystem that consists of various software solutions in internet platforms that unite startups, investors, business angels, experts, and professional scouts in a single business space, which makes it possible to solve quickly and efficiently any task in the field of innovation and startups. I'm happy to introduce you to the heart of our ecosystem, Startup Network. It's a marketplace for startups, businesses, investors, and service providers. Unicorn Battle is the oldest part of our ecosystem. Unicorn Battle is an open competition where startups pitch for private investors and venture funds. We almost have been in any place in the world where startups reside, but if you had seen a city or a country or region we haven't been to, but you would like us to come there, please contact me and we will do a battle with you in this place. Of course, we are missing our offline format. We were gathering together in Silicon Valley where our headquarters is, but to some point, online format is much better when you can log in from where you are and be with us all over the world. We have been doing our battles for 11 years already, from 2009. Have done more than 200 of them, and we are making good matches in finding best startups for the best investors, and they like each other and help dreams come true for everyone. Please meet our new program, Sci-Fi. It's an acceleration program for the startups willing to apply to top American accelerators. We help them to relocate to the United States, grant them funds and services worth $50,000, and invite best speakers and mentors to coach our startups online and offline. So join us to become a better version of yourself. Network VC California Seed Fund is the classical fund with 2 current strategies. First one, to participate as an investor in our pre-acceleration program for the chosen startups. And the second one, to be a lead investor in our Silicon Valley Syndicate Fund. And Silicon Valley Syndicate Fund, I would like to introduce my colleague, Julia. She will tell you what it is about.
Thank you,
Julia?
Anna. Thank you, Anna. Hi, everybody. My name is Julia. I'm Investor Relations Director of Silicon Valley Syndicate Club. We give an opportunity for private investors and business angels to invest together with experienced VCs into the best startups that we can find through our global ecosystem. It is an international club. We are officially registered in the USA. Closed club meetings are held online 2 times a month. Contact me directly if you want to know more about the club. I will send my contact details to the chat. And good luck to everyone today. Thank you. Anna.
Thank you, Julie. Yes, surely they need this luck always. It's a startup's life. Luck matters. I would like to introduce you to Slava, who will tell you what opportunities we have in investment business. Slava.
Hi all, my name is Slava Pedlisny. I'm a managing partner of Network Investments, which is actually the club for investment banks and investment professionals. We're creating a network which would help everyone becomes the part to get more investment opportunities, to look for some late-stage startups or businesses in other regions so that their clients, like family offices, PE funds, ultra-high net worth individuals could invest in. And surely for startups and for businesses, it's an additional source of funding, except like VCs and business angels that they could already look for. Thank you.
Thank you, Slava. And dear VC members, this information is for you because our VC House is a closed online community and network created exclusively for the VCs where they can exchange deals they participate in as elite investors. And what is more, this is also a platform for specialized offline and online events where VCs can interact with family offices and raise funds for their funds. And back to you, Marina. Let's rock and roll in Europe. That's our last event this season. So let's discover some great startups in HealthTech industry.
Okay, great. We really have very nice startups today, and when they are waiting for their time to pitch. But before, I would like to say a couple of words and greet our great partners who have been helping us a lot for spreading the word about the event and for networking and many other things. Thank you very much. We appreciate your help a lot. And now I would like to proceed to our agenda today. So we already had the organizers part, and now we're going to have the jury introduction part, after which we will have the pitching competition itself with the announcement of the winner afterwards. So now I would like to introduce our amazing juries today, and you have time now to say a couple of words about yourself, just 1 minute to jump in and introduce yourself, to tell more about your fund, to tell more about your investment opportunities and preferences, industries, and so on and so forth. And first of all, I would like to give a word to the founder of Startup Network and Unicorn Battles, Alexander. Alexander, hi.
Hello, Marina. Hello, Marina. Thank you very much. Welcome to our Unicorn Battle. Our seed fund usually invests from 50 to 250K. We prefer to invest in the companies which are located in the United States or Europe, and we are industry agnostic. Marina?
Thanks, Alexander. You're always the first. So who is going to be the next one?
I can go. So my name is Daniela Herman. I'm the founder and president of Topan, and we've been accompanying companies that are most resilient and gainers of the future, we assume, by developing economic, ecological, and ethical values. And we are specialized in growing and scaling young companies, micro, small, mid caps over long term. Thank you.
Thank you, Daniela. Greetings to Switzerland. And,
I can speak if you want.
okay.
Hello. So my name is Gary Fowler. I'm a serial entrepreneur and investor. I've done 16 companies and 2 unicorns. I was on the original management team at Click Software, was sold for $1.35 billion to Salesforce. I love AI. I've written almost 90 articles now on artificial intelligence and entrepreneurship. So we curate, my company is GSD, Get Shit Done Venture Studios. We're a Silicon Valley-based venture studio that's looking for teams, diverse teams from around the world. And what we do is we take them to Silicon Valley, take very close operational roles in the companies and help them go global. And as I said, we've done 16 companies today. We have 18 portfolio companies within GSD and moving quickly, especially during this digital transformation. Thank you very much, Anna and Marina.
Thank you very much, Gary. And by the way, we're having today some health tech startups plus AI. So
Oh, I love it.
it should be interesting.
Thank you.
Hello, may I suggest ladies first?
Hi.
I love Europe.
Right. If nobody is going, then I will go first, if that's all right.
Sure, absolutely. Hi, Preeti.
Thank you, Marina. Hi, Anna, Alexander, Marina. My name is Preeti Chaudhary, and I'm logging in from India today. I'm the founder of LinkedIn Local India and head of investments, partnerships, and alliances at InfoCrest LLP. We are sector agnostic, ticket sizes from 25K to 150K USD. Geographically looking at the Indian region, but now open for collaborations and helping global companies come into India. It's a pleasure being back here again. I'm looking forward to today. All the best to everybody participating, and thank you very much.
Thank you very much, Preeti, and thanks for your support and always spreading the word about the unicorn battles.
Morning, my name's Tom Kosnick.
Hi, Tom.
I'm a partner with Founders X Ventures here in Silicon Valley. We invest in deep tech, everything from artificial intelligence in various verticals to quantum computing and space. We're very happy to be part of this program again. And I would just say in terms of ticket size, we're 100,000 to 500,000 at seed. And if we see companies scale, we will invest 5 or 10 times that amount in Series A. And we talked about our areas of focus, so I'll just leave it for now to hear about the other judges who are here. Thanks.
Thanks, Tom.
Hello, everyone. I'm Lars Gotska. Is it okay for me, or should there be other ladies first? Or other ladies?
Perfectly fine.
Cool. We're a Dutch fund. We are focused on especially growth hack support to founders. We do pre-seed and seed stage. Our checks are 100 to 500,000 euros, and we follow up to 2 million afterwards when companies are scaling. We only focus on Russian-speaking founders, but they are all over the globe. And I mean, you know, all those unicorns that are from that region, and I think it's undervalued and underexposed. So although we're Dutch, we love the region, and anybody from that region is very happy to approach us.
Great, Bas. Thank you.
Perhaps I can go next.
Hi.
Okay. Hi, my name is Lisa Salud. I'm the general partner of R3I Ventures. Tom, looks like we'll be great syndication partners. We're also deep tech investors. We invest in space, quantum technologies, cybersecurity, medtech, renewable energy, ag tech, and healthcare. We are based in Singapore, Luxembourg, and Silicon Valley. And we are a deep tech cross-border venture fund. So we take predominantly out of Asia, scale into Europe and out through Silicon Valley. You might know my partner, Henry Wong, former Garage Tech Ventures. We're really excited to be here with you today, and every success to the founders. Thank you very much.
Thank you, Lisa.
I will go next, or is there any ladies that would like to introduce herself? Okay, then I'm Kirill Babic. I'm founder of Malmö Startups Agency. So we are in Frankfurt and Zurich-based company and focus on two main areas. On the one hand, we help venture capital firms to find suitable co-investors and lead investors for their deals and portfolio startups, but also to participate on other deals from our network. And we help startups to raise money. We are industry agnostic, but we prefer startups from seed or Series A rounds to Series C, and local-wise or location-wise, it's mostly European, Eastern Europe, and US. And I wish everyone good luck for today's challenge.
Thanks, Kirill.
Hi there, my name is Monica. I'm investment manager at Calmstorm. Calmstorm is digital health fund. We invest mostly in pre-seed and seed stages, and our investment ticket is between 50 to 250k euros. We are based in 3 towns, in Vienna, Berlin, and Warsaw, working fully remotely. We also have an interesting academy for founders, so this is a chance for people to get together and work together on the challenges. And today I'm super happy to be a part of this program and looking forward to listening to the pitches.
Thank you, Monica.
So I will allow myself to jump in that moment and just to say hello to Monica. I'm also located in Warsaw. My name is Jan Raczyński. I'm a managing partner at Rebels Valley. We are a consulting boutique and a accelerator for startups in Poland. We are focusing to help start, incubate, and scale up startups from our region.
Thanks, Jan.
Can I jump in?
No, sure. Hi, Kevin. Hello to Finland.
Hi.
And to Startup Grind Finland.
Yes. Hello, everyone. My name is Kelvin. I'm the current CEO and co-founder of Digital Growth Boost. But apart from my startup that I manage, I'm also the chapter director for Startup Grind in Helsinki. So Startup Grind is the largest startup or entrepreneurship ecosystem in the world with over 3.5 million active entrepreneurs and startups globally. We help inspire, educate, and connect startups, providing them with available resources just to help them build up innovative products. So if you are looking out to engage with startups or entrepreneurs in Finland or in the Nordics, then probably you should reach out. All the best of luck to the startups that will be pitching today, and I'm hoping to connect with you all afterwards. Thank you.
Thanks, Kevin.
Jarmo.
So I
Hello.
will do next.
Hi, Ran.
Hi.
Nice to see you.
Yes, my name is Siran Kilubi. I'm from Germany. I'm Managing Director of Brandpreneurs and Brandfluencers. We support pioneers, visionaries, and change makers in the area of digital marketing, community building, and corporate influencer. I work as a coach and advisor at different accelerators, incubators, and research centers. I'm also an expert advisor at the European Innovation Council Accelerator of the EU Commission for the Horizon 2020 program. And I'm part of the business angel network Go Beyond, and we invest in early stage startups from 50,000K to 500,000K. I'm really looking forward to meeting some exciting startups that might potentially shape our world. Thank you so much.
Thanks, Siran. Thanks for your support.
Thank you, Marina.
Hello.
Hi.
Greetings from Finland again. My name is Jarmo Haaplainen. I'm the venture partner from Smartup Capital. We have a 150 million euro fund in Luxembourg, though based in New York, landing European smart companies to US markets. At the same time, I'm personally involved with several startups, anything from early stage to A round, basically from Nordics, but all over. Thank you.
Thanks.
Hi, my name is Manish.
Sorry.
Hi, my name is Manish Arora, and I am representing PricewaterhouseCoopers Moscow, Russia. I am leading the healthcare advisory and industry practice at the office, and PwC Russia has a huge accelerator program for tech startups and scale-ups, and we're co-sponsored by Yellow Rockets. The program empowers a lot of talented founders to scale up their companies and provide access to global VC community as well as to PwC clients and partners. And so we have a program that provides at zero cost an uplift. I mean, it's called an uplift program, where we provide grants for pilot projects and cover the cost of your travel to Moscow, Russia, and so that you can focus on intensive work that you will do during the program. We also mentor using our leading experts and mentors from PwC. Can go into some into specific partnerships or even into post-program investing options, which are available up to 20 million rubles, which is around at today's rate around $500,000.
Thanks, Manish.
Yeah, thank you.
You're for the first time in the battle, right?
Yes, I'm here for the first time. Thank you very much, everybody, for calling me in, and I wish you all the very best for today. It's today's program and today's startups.
Thanks for coming.
Hi. Hi, everyone. I'm Sergey. I'm managing partner at Forces Capital Partners. We're a boutique venture capital and fundraising advisory company that have offices in Singapore, Bangkok, and Hong Kong. with interests in Europe and US. So we also use funds from our family offices, partners in Southeast Asia, and invest them in startups across the globe with a focus in US and Europe as well. So a pleasure again to be here, and good luck to all the participants. Thank you.
Thanks, Sergey.
Let me
I go next.
jump in. Oh, should I pass someone?
No, it's
Go
fine.
ahead.
Okay. No.
Yeah, it's Vitaly from St. Petersburg. I represent here with pleasure Insta Ventures, Cyprus-based venture fund, which is targeted as pretty industry agnostic to the software projects and direct-to-consumer startups. We mostly focused at the late seed venture as well as pre-A, and geographically we put our specific accent to the region around the Baltic Sea. So Germany, Poland, Baltic countries, including Estonia, Finland, and Sweden are in our core focus. I would add the only note: we are not committed to invest into the medical devices. All our industries are highly welcome, and I wish you good luck and happy to be there. It's not my first time at Unicorn Cup, but it's first time at the HealthTech specifically. Many thanks.
Thank you.
Hello, everyone. My name is Peter Honecker. I'm a venture partner at R3A Ventures. Lisa already introduced, and besides what she already mentioned, I would just add that we are launching the House of MedTech and Deep Tech in Luxembourg as a soft landing pad for any bright ideas in MedTech and a Deep Tech with specific focus on the first cohort in cybersecurity and deepfakes.
Thanks, Peter.
Okay, then I'll quickly jump in. Hello, everybody. Nice to be here again. My name is Dennis Kerpenstein from Faraday Venture Partners. We are a pan-European network of private investors, so high net worth individuals, family offices. We invest usually at a pretty early stage, though companies usually already generate revenues, and we invest something between 200 and 500,000 in our first rounds. And we're actually currently raising the proprietary fund as well to start supporting those companies even further. Looking forward to today's pitches. Thank you very much.
Thank you, Dennis. Somebody wants to.
Good morning, everyone. This is
Hi,
Jordan.
Jordan. Hi,
Good
Jordan.
morning to you. I'm in Silicon Valley. It's good to see a lot of friends and many new faces. I'm with Silicon Valley Venture Group, also with Scorpion Capital, and we invest in early stages, seed, pre-A, and occasionally A. Check sizes between 30 and 300,000. For round sizes of 300 to 3 million. We like all tech sectors that improve the human condition and contribute to getting us out of the situation we're in. I see Gary over there. Good morning, Gary. And I see my favorite, Anna. How are you, Anna? You're looking mighty sharp today. And I promise not to pick on the French today. I promise I won't say anything about the French today.
Thank you, Jordan, especially from me. This is actually like for pretty. This is tie I bought in India. It's handmade from India, but it suits, like it looks very European, don't you think?
It looks great. It makes us all look really bad, by the way.
I didn't intend to do that.
It is the Union Jack after all that I have on, Anna. So yeah.
Ah, cool. Great to see everyone. Okay, if anybody wants to present himself, it's time to do it. Or maybe Marina, you are there.
I'm waiting if somebody still wants to take the floor.
Okay. If anybody wants to take the floor, one. If anybody wants to take
Hello.
Okay.
Hello, everybody.
Okay.
Do you hear
Hi,
me?
Dmitry. Yep, you're audible.
Yeah, I'm happy to join to this event, and I want to two words about Innovation.Tech. I'm from Innovation.Tech. It's Ukrainian department. We interested in implemented different startup solution, a mature startup solution in our company. We interested in energy sector, and we are big enough in Ukraine, but we haven't any out of Ukraine subsidiaries. So we want to try new solutions, new business, and we don't buy startups, but we are acting like industrial partner. And you can visit our website, openinnovation.dtech.com, and can apply to our apply with your solution, and we will respond and make connection with you. Thank you.
Thank you, Dmitry. Thanks for joining us today. Last chance to make an intro. Okay, so if we're done with the intro part, I can switch to the pitching part, and I can open the pitching part. And before I open the pitching part, I would like to remind our dear juries that you have got your personal voting link, each of you, and you just click the voting link, you scroll down, and you will find the startups with the ability to rate them besides. And you can rate the startups from 1 till 5, where 5 is the highest mark, and we are evaluating the investment potential actually. So 5, it means that the startup has the highest investment potential. Also our visitors today, we have a lot of angel investors whom we don't see. So like normally we don't see angels, but we know that they exist, right? So you are very welcome to come also to our website, to the landing page, and to vote for the startup you like. You can just put the thumbs up for any startup you like, and we will see your preferences in the end of the battle. And now we have the list of our amazing startups. And I would like to remind also that we recommend not to mention any fundraising out loud, because we are broadcasting all over the world and some countries have restrictions in this regard. Please use chat or other channels of communication for this particular reason. And thank you. And based on the result of the judges' online voting, one startup will be chosen as the winner of the Unicorn battle today. So please welcome our startups, and startup number 1 is Searchmark. It's from Germany. Hi, Rudina. Are you ready to be number 1 and to open the pitching session today?
Yes, I am. So may I share my screen?
Sure. I'm opening the timer.
All right. So thanks once again, Marina, for the opportunity to be here, and thanks everyone who is looking at this. So I will start actually addressing all the women who are watching us today. So imagine before you joined the event, you had to pass by your doctor and you got the scary news that you got breast cancer. You know, I don't have telepathic superpowers, but I will guess in most women, what will be the thoughts? The first thought is, I will lose my hair. The second thought is, I may lose my breast. And only the third one is, I may die. And I will tell you why this. Pretty much everyone knows that breast cancer treatment has developed a lot in the past years, and they are quite effective to treat the cancer. The issue is side effects. They are terrifying. Most women are afraid of them. And doctors today, they know we have overtreated patients. We have given too much harsh treatments to the women, and it shouldn't be like that. Women don't deserve such a painful sort of treatment to solve a problem, because a lot of cancers actually could have disappeared naturally. Your body could have got rid of it. But the issue is we don't know which tumor, which lesion will disappear, which one will become a problem. For this, doctors are now marking They are putting small markers. They are usually metal. They are placed inside, close to the tumor, close to the lesion, and the doctors can follow up and look if this will develop into a big problem or not. However, those markers, they are very far from perfect. They are they are metal-based, so that means they are hard. They are limited with the visibility in ultrasound, which is a problem because any woman who did a mammography can attest it is not pleasing. You know, it squeezes the breast, it's painful, and if you have a little nail inside your breast, that means this thing will cause more pain. Those metal markers migrate and they stay there forever. So based on this, we developed one marker, it's a new marker, which is completely soft. It's as soft as a gelatin. And it stays because it attaches and adheres to the tissue, doesn't migrate, stays there. And although it can be seen in all techniques, all imaging techniques, is especially suitable for ultrasound. And ultrasound is the future in this field. So besides that, it's not only for breast cancer. We can apply this in the other type of cancers like lung and prostate and liver cancer. So the business opportunity is roughly 600 million euro. And the team of Surgemark is a very solid team. Everyone is serial entrepreneur, scientist, and we also have medical doctors and surgeons. And we are looking forward to get a sure sign and the best sign of success in this field. Thank you for your time.
Thank you, Revelina. Perfect timing. And any questions? I'm sure there will be a lot of questions.
Good morning, sir. Thank you for doing this. I lost some family members from breast cancer, and I know exactly the suffering and the pain they go from. So this is greatly appreciated. Just in 3 or 4 bullets, what's your current traction in terms of the product and the utility of what you're using? Do you have any IP, strong IP against this? And where do you plan to scale geographically?
So thanks for your question, Jordan. First of all, we do have IP, and we are right now writing a second IP based on the prototypes we have developed lately. We are preparing the FDA submission, the 510K submission. So we want to start like soon next year to submit the documentation. We want to enter the US market first for 2 reasons. First, the European market is a mess now with the change in regulation for medical devices. And second, the pricing for such device, for such markers are high in the US. And pretty much every biopsy in the US, doctors will implant a marker today. So that's why US is our first and preferable market at this moment.
Great. Any other questions?
What's your path to market, sir? How do you engage? Are you engaging through the service providers? Tell us more about that.
So yeah, well, first of all, we will partner with a big distributor. There is no way around. We have to work with someone. After we get the 510K, we are discussing right now with other big companies, because you have to understand that all companies out there, nobody's happy with their markers. We are now discussing with a potential partner that we could deal with, and it goes direct to the hospital and clinics. So that's how we in this field, that's how we go. And of course, we are already contacting some doctors in the US, Canada, and also in Europe that they can do some clinical trials to gain like key opinion leaders. So these people are the ones who will, push the other doctors to adopt the technology, because there is an adoption phase. Although it's implanted the same way, we don't change the technology in any form for the application. We don't want to teach new techniques for the doctors, because we know evangelizing in this field is a complicated thing. So we use the same techniques.
What makes you a good fit for this? Why are you the guy for this?
So I have developed a few other medical devices. I brought some medical devices to the market, especially with this biomaterial. I am happy to belong to the small group of people who knows how to make medical devices out of this. In Europe, I've been involved in, I would say, at least 50% of the products that exist in the market using this biomaterial.
Thank you, Revelina. Time is up. And I'm excited to introduce the startup number 2. It's Zaif. It's from Lithuania, and sorry. And that startup helps people with heart problems to live calmly and comfortably. Hi, is it Venus? Can you tell us more about this? Hello.
Hello, just a second. Oh.
Yeah, we hear you. Yeah, we see you now. Fine.
Okay, just a second. I will share the screen. So, thank you for invitation to participate in this meeting. What we want to present is we are a Lithuanian company called Zaif. We are based in Vilnius, Lithuania. We are a startup company for more than 3 years, and we already won some awards, which one of them is United Nations sponsored World Summit Award. And what we want to present today is CEA certified patient-oriented multi-disease prediction and monitoring system. It's a complicated name, but I will explain what we offer. So what we target home users, but usually for the home users, the devices which are sold for the home users are not medical grade. We wanted to change that, so we in-house developed a medical grade recorder. Our system is designed by doctors. So we have this acronym D2D, D2P, and it's designed by doctors to doctors and by doctors to patient. We wanted to eliminate the problem that when engineers design the devices, they usually design it not for doctors, not for physician use. So that's why these devices are not comfortable to use in professional practice. So our business opportunity also was enhanced by COVID awareness. So everybody is now in some sort of lockdown. It depends on the country. So if you have the device in house, it means then you don't need to go to or visit the hospital on a frequent basis. So what we already achieved, so we developed in-house and certified ECG sensor. It's already certified in Europe as Class 2 medical device. It means we already spent almost 2 years in developing and certifying the sensor. It's already done. So what we achieved, we have a real-time display on a smartphone or PC. So we have full display of ECG on the device. We have already developed a viewer for detailed ECG examination. And also we have an option to send the data to physician for analysis. What to be done? So we want to do a real-time data analysis and report to patient, transcending multiple medical branches. What do we mean by that? Is that the idea is not to cover only cardiology, but also different branches of medicine. So it's also related to toxicology, infectology, dietology, neurology, because not only the cardiologists need sensor data from ECG, but all will be...
Up just a couple of last phrases.
Okay, and so we developed this sensor, and we have a medical team, so it is developed by the doctors from different medical branches, and we appreciate their input in our device. So this is our solution team, and thank you for this short presentation.
Thanks, and Venus, can you switch on your video, please?
Okay.
Any questions from juries?
So Venus, it's Lisa Salud from Singapore. There's a lot of wearable type devices in the market that are offering early prediction of heart failure, etc., 6 days in advance. How do you compete with technologies like this in your context?
So as we mentioned before, we provide multi-purpose applications. So it's not only for cardiology. If you suffer from neurological diseases, or you are on a diet of some kind of nutritional diseases, it's not only cardiology. So at least now our application will offer at least 6 different branches, as well as cardiology. Cardiology is main input. But as far as we know, nobody does more than cardiology.
And are they certified in all contexts or just in cardiology? I didn't quite catch what you were medically approved for.
Yeah, we develop the hardware. So we certify the hardware. So it's our in-house developed internal hardware, and we certified it. Now we are building artificial intelligence software for the hardware.
Thank you.
What's your geographical strategy as long as also the distribution strategy in this case?
We are targeting European markets. So we have CE certificate. It means that we can freely sell our device in all EU plus extra for 5 states which recognize EU certification. So for the time being, we are planning to scale in EU.
Well, but EU is definitely a fragmented market in terms of languages, different doctors, practices. So what countries
so
are like
as we are located in the Baltics, so Central Europe and Nordic market is our primary market, with aging population and so on and so forth.
Okay, thank
you. Any other question?
Yeah, are you planning to have your solution working with other devices, or are you just going to be strictly tied to your own device?
In the time being, we do not plan to work with other devices. It will be with only our device and our hardware.
What's the rationale behind that?
The rationale for the time being, we are not planning to do that, but it could change. If we get some additional data or additional cooperation, we are open-minded, we could change that.
Is it a strategy? Is it a resource? Is it a technology?
It's all of our competitors in the market. They do not share their hardware information with the software vendors. So we have some standalone solution for the software. We have some standalone for the solution for the hardware, but no, or at least a few competitors integrate both.
Got it. I didn't know if I caught it or missed it. Is there any field trials, any actual trials on this, and how many units?
We already, during COVID pandemic, we tried our device in the hospital. So, and the feedback from doctors and patients is favorable.
All right. Thank you, sir. Well done.
Thank you.
Okay, time is up. Thanks. And I'm excited to invite the next startup, whose name is Adesante. And this is a fully autonomous robotic surgery to become true. And here's Petteri from Finland, right?
Yes, exactly. Hi there. I'm Petteri, the CEO of a company called Adesante, and our flagship product is with surgery vision, with which we have one vision, which is to provide fully autonomous robotic surgery available. And why? Because even though the startup business needs some luck, but same applies if you need the surgeon services, if you need to be operated. Because unfortunately, the surgeons are also human beings and they tend to make some failures. Not many, but still some. And 60% of these failures are causing temporary injury, and every third, even permanent injury, and even more severe, 7% of these surgical failures are causing wrongful deaths. And if we put it into the global scale, it means quite a significant number unnecessary deaths caused every year. Another challenge is that surgeons, especially the skilled ones, are a very scarce resource. These resources are used mainly or quite often for very basic surgical procedures, like doing some shallow skin procedures and these kind of things. And the most skilled ones operate only in most prestige hospitals and are well paid by them and happy to work in there. But what is the reason why robots are not operating human beings doing some basic stuff? Because every patient's anatomy is different and the human organs are moving differently. Your organs are moving differently than mine when we go through the surgery. But there is a solution coming into the market together with us, with the Surgery Vision product. Already 2 years ago, we launched the first version of the Surgery Vision, which was mainly for viewing surgical images and viewing the planning images, CT and MRI scans, and we converted from those hundreds and hundreds of CT and MRI scans, one three-dimensional stereoscopic model. Last year, the surgeons were able to plan the procedure on those images and present that image on the wall of the operating theater while operating. This year, we brought NVIDIA Clara AI into the system. We are able to automatically detect some abnormalities from the image and help surgeons to make the surgical planning. Then placing this image, placing the plan on top of the patient while operating will be our next goal to reach in next year. When we are able to do that, then the surgeon can see below the cut, making no surgical failures anymore. And then everything is as a data, and then we have a visual connection which we can merge together with the plan. It will be possible to let robots operate human beings autonomously. The market is huge, which is pretty clear, but the team is ready, product is ready. We are scaling up, developing product further towards zero surgical failures, and for that we are fundraising. Thank you so much for your interest. In case any further information you would need, please don't hesitate to contact me directly.
Any other questions?
Petteri, there's a lot of competitors for automated surgical robots in China. How do you compare?
And it's great that they are in there because it increases the market awareness. Autonomous robotic actually does not exist as such. There are some robots which are operated by the surgeons and remotely controlled, but autonomously operating only very minor shallow procedures. But this is where we are heading. We are trying to provide a platform for all robotic manufacturers for letting them operate even the deep tissues of the human body as soon as possible. My estimation is 2025.
You should check out the Blue Xing Cancer Hospital in China.
That's true. Thank you.
Some more chance.
So you don't have a robot today, but you already have revenues. What are you selling today?
We sell software only. So we deploy software over the cloud services to the hospital, and it's a subscription-based business model. So they pay monthly fee for using the software for planning, and we are not even willing to sell any robots or deploy any robots in the future. We try to remain, or we are willing to remain as a platform provider for planning robotic surgery for all robotic companies.
Okay, thank you.
And we have university hospitals using our application already, from the tiny microsurgery procedures up to the huge trauma centers.
And what is your revenue?
Monthly revenue is below 10,000 euros currently.
Okay, thank you.
Over how many weeks or months or quarters?
Sorry?
10,000 over what period of time, sir?
In month.
Oh, it's $10,000 a month? Euros
Yes.
a month?
Yes, and the break-even target is somewhere around 40,000 euros per month, and that doesn't require too many additional customers for achieving that. The target was already in this spring, but unfortunately, due to some well-known facts what happened in the market, it has been postponed until next spring. So estimation for break-even is Q2 2021.
You have expansion plans overseas?
Yes, we do. And actually we are right now today. I was looking at how to establish a company to the US, how to open an account. We have distributors in 17 countries, Europe, Middle East, and Southeast Asia, but the next step will be definitely US.
Yeah, let us know. Tons of us on the call can help you with that, but reach out to any of the US investors and we'll be able to help you.
Good. Thank you, Jordan.
Thank you very much, Petteri. Time is up. I'm excited to announce the next startup, who is called Resilient. And that startup develops your resilience to stress and burnout. Hi, Max. Max? Oh, okay. Hello, we don't hear you. We don't hear you, but we see the presentation.
Oh, he sent a text earlier saying his internet is not working too well. Is this for MedCap?
something else wrong. Can you hear me now?
Yeah. Yes, it's fine.
Oh, sorry.
No, it's fine.
Oh, okay, I don't know. There must have been something wrong with the connection, the microphone. I just plugged it in and out again. So, okay, I'll start right away. Sorry about that. So I'm Max. I'm a co-founder and the CEO of Resilient. And the problem we're solving or we're tackling is burnout. And so burnout is a bit of a pandemic in the mental health sector. Its frequency is increasing very fast. And currently today, 1 in 5 employees are actually at severe risk of burnout. And the other problem we see is once you get there, it takes ages to get out. And even worse, over half of all the burnout patients, they never actually make it out of it completely. So, 50% or more never return to their previous careers. So this comes at massive burdens for the economy, and those are just the financial burdens. Of course, there are a lot more other suffering. So what is our solution? Well, we work together with medical doctors, or mainly psychiatrists and psychologists, to kind of discuss what we can do about this. And we discovered that their best success rate is early detection. And we decided, let's go a step ahead, because with today's AI and all the data we can collect nowadays, we can do more than that. So we're actually predicting burnout in advance. And if the burnout risk is high, we have an automated system that actually gives lifestyle therapeutics based trained on cognitive behavioral therapy. And this knowledge comes from medical doctors and therapists. On top of it, in this way, we also decided to target employees. We also have another model that we're later on moving into, but for now, we're focusing on occupational health prevention. Companies will get additional insights, statistical insights, how their workforce is doing to make smarter decisions in how they manage their human resources. So basically in the end, but it's not an expensive personal therapist. We're also not another meditation app, and it's not just a simple wearable tracker. We don't actually produce our own hardware. We're compatible with different hardware. If you look at our team, it's stacked with psychiatrists, people in data science. We have, of course, we need IT people, developers. Our advisory board is full of the top experts, actually world-renowned, some of them like Barbara Hochstrasser or Professor Thomas Berger. They're both top experts in their fields in either burnout therapy or online therapy. We managed to get partnerships and pre-sales with Switzerland's largest healthcare providers, which are the three there, Clienia, Michel Group, and Cyburn AG. And we just this summer got accepted into the digital health incubator Biopol, which is the digital health hub of Switzerland, where we're partnering with SCHIF, which it's one of the largest hospitals in the country. We got a distribution agreement with Droppa, which is a pharmacy, because there is a hardware component. We initially, as we said, we have a second business model. We worked with a company that made a medical device that has to be distributed through them. And we actually managed to get a grant from the Swiss government, a project grant, and that they financed the co-development of the solution, or the research basically. And we are now coached by the same institution. It's called InnoSwiss. It's like an innovation agency that helps startups to get off the ground. So our market opportunity is large, and we're targeting companies with 50 or more employees. The first step is Europe and then North America. And companies, languages, because it has a therapeutic part, we have to focus on language. We said we're limiting it to English, German, and French. German and French are native in Switzerland, that's why, and English, of course, it's the largest market. In 5 years, we aim to target about 5 million users online on the system. And how we can achieve this is basically what differentiates us, or what's the secret sauce. Our solution is scalable, yet it's effective, because with AI we can, give customized recommendations to people, which are those so-called lifestyle therapeutics. And these are based on the predictions that we make in the background. On top of it, we're hardware neutral, so this can work with wearables like this one. And we also take other data sources into consideration.
Max, sorry, you've exceeded the time.
No problem. This is actually it. If you have any more questions, you can always contact me by email.
Wait 2 minutes for questions.
Yeah.
Hi, so I have a question. What's the status of the business now? Do you have revenue? And also, what's your marketing? How do you get people to use it?
Currently, we're pre-revenue. We did get for the other business model we had before, but as mentioned before, the European law, they changed the medical certification. So we had the business model previously to go into clinics to use it as a reintegration tool for burnout patients. That's what the clinics pre-purchased. And now we changed the business model into occupational health, where the clinics are using it now internally because their own staff is also always a bit on the edge. I mean, healthcare providers themselves, they're actually known to be the highest risk groups. Physician burnout is the biggest.
But no clear outreach. Do you do email marketing? How do you convert the ideal customer profile?
We actually haven't done that yet because we just changed the business model this summer together with the coaching that got in. So basically, a couple of weeks ago, we decided let's switch the position around because initially it was first clinical and then corporate, and now we just did the reverse because getting certification for such a thing with therapeutics will take 3 to 5 years, and that's not interesting for a startup. That's big medtech business.
How does it work? Give me a use case. Jordan, myself, I want to use your system. What do I do after I sign up? Blah 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 blah. Then what?
So it's actually not you directly. It's your employer signs up, and that usually our goal to enter the market is through health insurance companies because they're already in the communication with that. So they go to your employer, SV Ventures, and they will come to you and say, "Hey, we have a recommendation here." They buy a wearable for you. There are third-party wearables from Garmin, Samsung, and Co. that they can choose from. We have a list of compatible devices that give us the data we need, that we verified, and then this starts collecting data. This data is completely anonymous to your employer. Every employee has the right to basically turn on and off what they want to share, if they even want to be considered in the statistics or not. It's highly recommended they do, but we can't force anyone, and we don't want to. So the next step is it collects the data. It also asks questions. And these questions are from a chatbot. So you talk back and forth, and it categorizes your strengths, weaknesses. We have 6 broad categories and where we can see the alarm bells of users. It analyzes that, and then based on this pattern that you have in those 6 categories, it creates a risk, and we use the biometric data on top of it to see the severity of the risk. Like, is it going up or down? And yeah, it's a bit complicated to explain, sorry. But overall, what happens is we get input from biometric data, we get input from user data, we use smartphone sensors and so on to get a whole picture, and this is then shared with the user.
Thank you.
Thank you so much, Max.
Thank you, guys.
Our next startup is also from Switzerland, and here is Emily, who's going to present Ancora AI. Emily, hi.
Hi, everyone. Can you hear me fine?
Yes.
Always worth a check.
Can you try full screen? Okay. Yeah.
All set?
Yes.
Great. Okay. So thanks so much for having me. I'd like to tell you a bit about Ancora AI and the work we're doing in the clinical research space. So clinical research is a $47 billion global industry that depends on the participation of patients and physicians to bring new drugs and innovations to medicine and to market. Currently, patients struggle to understand and access information about trials on their own, so most rely on doctors to suggest trials to them. The vast majority of physicians, more than 83%, think that trials benefit patients when they participate, but only a minority, less than 1 in 5 patients, actually hear about trials from their doctor due to lack of time and lack of knowledge, because it's a very quickly evolving space. And this prevents doctors from referring their patients to trials. This problem overall means that 80% or more of trials are delayed due to challenges with recruitment or failure to find the right patients on the trial. Each day of delay can mean millions in lost potential sales on patent, and importantly, also impacts patient lives, particularly in cancer, which is where our company has started to focus. With COVID, of course, these problems are becoming even more of a challenge, but I'd like to also kind of give a silver lining, which is that COVID has been as well a spark to drive digital innovation in this industry, which has been much needed for a long time. So I'm sure you've seen the increase in telehealth, for example, or remote services for patients. We believe that this change is here to stay and that at this critical juncture in clinical trials, we can build something to revolutionize the patient experience and the clinical trial interaction. So I'd like to introduce our solution, Encora AI, which is a platform that seamlessly and digitally connects patients and medical professionals to the world of clinical research. We've already launched our first module, which connects patients and physicians to trial search and eligibility check using AI as a translator. In less than 5 minutes, anyone can identify potential clinical trials with suitable eligibility criteria. Previously, this process would take hours. We have a pilot underway with an academic cancer center, users in more than 90 countries, and we currently support 14 indications in oncology, as well as COVID-19. Our roadmap for the future extends this solution along the whole patient journey on clinical trials, serving as the technical backbone for the patient experience throughout the trial. Revenue streams for our B2B business model are twofold. First, a volume-based subscription fee for trial sponsors to access our patient trial connector. And second, a fee for sponsors to offer our trial services integrator to their trial participants. Encora AI will bring increased patient satisfaction on trials, as well as efficiency and increased patient diversity to the trial ecosystem. We are a diverse and gender balanced team of 11 individuals in Switzerland, Germany, and Croatia, comprising data, science, and commercial experts. Our founding team has a collective more than 30 years in healthcare. Danielle, our CEO, is also our CTO and is the technical mastermind with extensive experience developing AI and machine learning solutions for pharma. Luca and I, also shown here, both have bioscience PhDs. My experience is in strategic and operational roles in health tech startups, and Luca was most recently designing commercial business models at Roche, a top 3 pharma. I'm happy to answer any of your questions, and please check out our website, which is free for anyone to access at Encora.ai.
Thank you, Emily. Question opportunity.
What is your...
Emily, okay, go ahead.
But Peter, go ahead.
No, I was just curious, Emily. Good presentation. So, does the patients look for participation in the trials? Do they get compensated in any way?
So typically, patients do not get compensated for the type of trials that we're most interested in. So phase 1 trials, for example, first in human studies, patients could receive a small fee that's paid by the pharma sponsor. But for phase 3 trials in oncology, which are where the money in the industry is and kind of where the biggest innovations are, typically patients are incentivized to participate because they receive early access to life-saving and innovative medication.
So it's depending on the actual users to look for the trials, or is it going to be recommended by doctors, or like how is it going to work?
It's both. So the problem of difficulty finding trials exists both for patients and physicians at the moment, and we have a solution for both patients and a specific solution for physicians, which brings you to the same place to find trials.
Okay, thank you.
What is your traction today in terms of revenue?
We are a pre-seed company, so we are pre-revenue. We're currently focused on user growth. We launched in March at the height of the pandemic. So you can imagine it's been an interesting time for clinical trials, but also a really awesome time to create something digital in this space. So we currently, as I said, have users in more than 90 countries in the world. We're a global solution. And we are focused next year on getting first pharma partnerships in place once we've released our first study, which we'll present at ASCO next year.
Can you tell quickly a few components of how you're managing growth, or what channels do you use, what marketing?
Yes, sure. At this point, we are focused very much on organic growth, content-driven SEO, partnerships with patient organizations, partnerships with hospitals and academic institutions, and key opinion leaders. So you can see my Instagram handle here. Please check us out on social media. We've been really successful also working through patient groups, specifically in very high unmet need indications like colorectal cancer and metastatic breast cancer, where patients have a huge need to access clinical trials.
Can you disclose some unit economics? What's your customer acquisition cost and expected lifetime value?
I'm happy to follow up kind of offline about those numbers if you're interested in a longer chat.
Okay, cool.
Thank you, Emily and Denza. And we have another great startup from the UK. And Fiona gonna tell us more about how they create accessible mental well-being solutions.
Hello, can everyone hear me?
Fiona, yeah, I see you. I see the print screen share.
Thank you very much. Hello, everybody. I'm Fiona McKinnon. I'm the CEO and co-founder of Moment Company. How often do you use or hear the excuse, I just don't have the time, when thinking about making space for your mental well-being? We are all busy. At Moment Company, we make the practice of taking short mental breaks a quick and effortless habit like brushing your teeth. The impact of stress on mental health across the world is huge. 1 billion people are thought to be affected, and that number is only growing under the current climate 2020. Take a moment to pause here. Does this figure include you? If not, it will include someone that you know. We were certainly part of those statistics, and it's our personal experience of burnout and stress that drove us to create the Moment Company. As I mentioned, one of the key perceived barriers to tackling stress is lack of time. And that's why we champion moments. In as little as 30 seconds, we all have the power to reset our body and mind, to take a breath, to calm our nervous system, and to create space for a more positive mindset. Human attachment behaviours are instinctive and formed from birth. We use objects as emotional support. Think of a child with a teddy bear, or as adults enjoying a cup of tea with our favourite mug. This attachment behaviour is why our core products and customer experience are embedded in a physical object, separate from connected devices, which are often a key source of stress. It's this real world connection that sets us apart from the crowded app market space, dominated by companies like Headspace and Calm. Our launch product is Moment Method, a wellbeing practice anchored in the Moment Pebble, a hand-finished, light-led device that visually guides you through a breathing sequence. It's portable and can be used at any time throughout the day. It's a companion for your mental well-being. The Pebble light sequence follows a cardiac coherent breathing technique and guides you to take a breath in to the count of 5 as the light increases and out as it dims. Moments can also be taken away from your screen through voice-activated guided sessions on Alexa. Early research shows that a single moment can reduce stress by up to 12%. At Moment Company, our solutions are underpinned by research data and clinical expertise within our executive team, through commercial and corporate brand partnerships, and a network of online resources and support. The addressable market for wellbeing solutions is growing rapidly as, sadly, more of us are seeking help. COVID-19 has brought stress and mental well-being conversations into all of our homes, to the forefront of media and into our governments. Now is the time to invest in yourself and in businesses that are innovating to solve the problem. Stress is the secondary pandemic. The mission is bold yet simple. We want people to live healthier, happier lives. We've recently opened a fundraising round to realise this vision and to accelerate our growth. Moment Pebbles are in production and demand is growing. As you know, time is precious, so thank you for yours today, and I welcome the opportunity to answer your questions.
Thank you so much, Fiona.
Thank you very much. I have one question. What are your current revenues and what are your current revenues? How much do you make?
So at the moment, our Pebbles are in production. We raised money last year through a Kickstarter campaign, and the Pebbles that we have in production, 75% of those are pre-sold, but this is our first direct-to-consumer production run that we're doing now. So we have a small amount of revenue from Kickstarter, and we expect revenues to kick off at the end of the year.
Thanks.
Hi, my name is Julia. I have a question, like because right now there are so many sort of mindfulness applications and platforms out there, and how would you compete against companies like I mean, Headspace, Calm, or do you even see yourself or them as a competitor to your company?
Headspace and Calm are fantastic businesses. Our main point of difference, as I mentioned in my presentation, is that we ground our practice in a physical object, and is this connection and reminder that stands us apart from the services that Headspace and Calm offer. You have to remember to go into your phone to then find the meditation that you want to go through. And so our experience is one that sits in the real world, but we also do have guided meditations that support the use of our Pebble, but we welcome apps and anyone that's looking to improve and support mental well-being. So we see these businesses as aspirational and potential partners.
Thank you. Any question? The last one? Okay, so thank you very much, Fiona. And I would like to remind the juries that you need to reload your voting page because one startup has to leave us because of connection problems. That was MedicPad, and we have already removed it from the list. So please refresh your page. And we have 2 startups left. Now it's time for STEMI Global. Hi, Andrei. And tell us more about 7 minutes, which add a life, yeah? Hi. Andrei, we see your presentation, but we don't hear you.
Okay, I think now it should be working. Am I right?
Okay. Nice.
Okay, very good. Ladies and gentlemen, when saving patients in emergency situations, the speed is crucial. Every minute saved makes a difference to whether they live or die. And assuming that they do survive, the question remains, what will be the prognosis of their life and how much money will the healthcare sector needs to spend in order to keep them living happy and productive lives? Medical rescue teams all around the world face one big issue: communication barriers. And these barriers cause them to act in isolation, slow them down, and reduce their effectiveness. Our company has been dedicated to tearing down these barriers through powerful communication platform STEMI. STEMI connects healthcare professionals in the region and turns them into one virtual team. It is used for the management of heart attack, stroke, trauma, and recently COVID-19 cases. Let me give you just one out of several illustrations. This is a patient suffering from heart attack, and this is the cardiac center. It is the only place in the region where they can get the proper treatment that they need. Unfortunately, quite often paramedics bring patients to a regional hospital first because they are unsure of the correct diagnosis. Once the heart attack is confirmed, the patient is transported to the cardiac center. This is called the secondary transportation, and it causes unacceptable time delays. In fact, it really is a global problem. It is estimated that the rate of secondary transportation ranges from 30 to 60%, depending on the country. Thanks to STEMI, it is possible to diagnose the patient remotely even before they arrive to the hospital. If direct transportation is needed to the cardiac center, it can be easily organized. On the other side, the hospital staff in a particular specialized center receives timely information about the patient, their clinical status, as well as estimated time of arrival, so they can prepare their emergency team just in time. Using STEMI on a national level in Slovakia, on the scope of a little bit more than 300 ambulances and approximately 50 hospitals, we managed to decrease the rate of secondary transportations by 64%. As well, we decreased an average interventional time or time to treatment by 60 minutes. This basically means that the patient today has a chance of survival more than twice higher than before. Due to its impact, STEMI was awarded as an IT Product of the Year in Slovakia, Central Europe, and 2 years later, we were also selected among the top 10 telehealth startups by a particular American healthcare magazine. The founder of the idea is actually my own father, one of the leading cardiologists in the country, but our whole team is very professional and agile. However, there is one more seat still empty on it, so do not hesitate and join us on our mission of saving minutes and adding life. Thank you very much.
Thank you, Andrei. Perfect timing. Questions? Any questions?
The company already exists for about 4 years, if I'm not mistaken, like from 2016. And what are the results in terms of revenues and in terms of geographical distribution? Because currently you are still in Slovakia, like if I'm not mistaken.
The company was incorporated in 2017 officially. And we are early revenue generating startup at the moment. Our annual revenue is approximately $300,000. The truth is we are at the moment monetizing only from our homeland, but we have already launched multiple initiatives to get STEMI beyond the borders of our country. For example, this month we are launching a pilot in Buenos Aires, in Argentina. Probably 2 months after that, we will be in Sao Paulo in Brazil. And we have received multiple letters of intents from countries. There is one hospital from the United States, a couple of them from Europe. And we are also integrated in 2 catalyzers in Europe. One is in Portugal, another is in the UK. So this is actually the year that we felt ready, really starting our international expansion earlier this year.
Okay, and who pays for the technology? I mean, who's the buyer?
Okay, there is a 2-level solution. In the beginning, when we enter the country, it's usually the hospital which disburses annual license, and emergency medical services get it for free. However, at certain point where we are able to validate the results, we approach the government directly. This is what actually happened in Slovakia, or other healthcare institutions such as health insurance company or the dispatch center in that country, and propose a solution for a regional or nationwide implementation. And at that point, it is possible that it is the government who takes over the payment of the license on their shoulders, because it yields benefits for the healthcare system as such.
Okay, so the government is the main buyer of your solution, if I'm not mistaken.
Yeah, this is the ideal scenario. However, we are able to monetize even on this lower level, which is on the level of a particular hospitals. In fact, we managed to reach our break even in a limited way. So approximately 70–80% of our costs is already covered. The rest is funded through grants. However, in order to support our international expansion and scalability, we are in search of an investor.
Okay, thank you.
You're welcome.
Tell me about the founders and the background and the history of whom they are. I can't find anything about them online.
Okay. A father of mine, as I mentioned, one of the leading cardiologists in the country, has been dedicated to these areas for more than 3 decades. He was actually responsible for improvement of the management of acute myocardial infarction in the country as a whole. And the communication barriers between different teams participating in the life-saving process was the main issue he identified. So he came with this idea: we need to have a simple to use, straightforward communication platform that every paramedic, every doctor, more elderly or younger, will be able to use, ideally using their regular smartphones. Of course, my father as a doctor needed to build a team around himself. So this was when me and my brother, involved in the field of IT, business and marketing, stepped in and brought some of our friends from the IT. And this is how we set up the company. So I am, my father, we are the majority shareholders at the moment, and we have fully bootstrapped until this point.
You're currently in Argentina for a Slovakian company, and you're marketing in South America and North America. Am I hearing this right?
Yeah, it's Europe, and then it's Latin America. Now we are doing our plans for North America as well. However, We have also received a few letters of intent from the countries of the former Soviet Union, for example, Kazakhstan, Ukraine, and we already did a small pilot in Yugra region in Russia last year as well. But our main focus at the moment, at this stage, is Europe and Latin America, the second level, post-Soviet countries and North America.
Thank you, sir.
Thank
well
you
done.
very much, Andrei. And we have the last startup now. And
Can I have a question, please? Can I have a question, please, to Andrei? Andrei, one last question from Manish. Have you thought about implementing AI or any of triage moments into your application so as to let's say try to improve the diagnosis and help the doctors to make diagnosis earlier in reducing the consultation time, because there is a lot of instances when the diagnosis itself is wrong. Yeah, maybe that could be another time saving factor that could be added onto it.
Definitely, I'll be fast, Marina, I promise. It's one of the next things on our backlog to implement AI-based approach to digitization of the ECG curve. And the very next step is evaluation of that ECG curve to provide even more prompt guidance to the paramedic about the probability of myocardial infarction. So yes, this is on our backlog, and so is the connection to the 5G internet.
Yeah. Good luck.
The good news, Andrei, the baby agrees with you, so you are in.
Amen.
Yes, absolutely. Nice work, Andrei.
Thank you very much.
And we should have the last startup for today from Sweden. It's called Brighter AB and Smart Integrated Digital Outpatient Solutions. So let's find out more. And here is Henrik to tell us more. Hi, Henrik.
Hi, how are you?
I'm great. Looking forward to hear you.
Can you see my screen as well?
Yeah.
The classical question.
Absolutely.
Well, thank you everyone for wanting to, well, first of all, honored to be here and being a selected startup on this perspective. So my name is Henrik Nordström. I'm the CEO and an early investor into Brighter. Oops, something happened here, of course. Well, first of all, imagine yourself waking up one day, realizing that you have diabetes, whether it's a type 1 or type 2 diabetes, it doesn't really matter. But from one day to another, you suddenly have a completely new set of routines that you have to follow, whether it's about the food choice, whether it's about the exercise, or even then having to check your blood glucose values and take new medicines, starting from maybe once a week to multiple times a day, with different medicines up to 3 times a day injecting insulin. That is no doubt something that is really a challenge to a lot of people. And that's what Brighter is addressing. So basically what we have done at Brighter is to look at the market, and coming from the founder's wife, who is a diabetic, and who really looked at, had a challenging, challenging pregnancy, and he found the solution to helping this out with the Actis solution, based on the fact that looking at the whole global market with over 460 million people suffering from this, and very few actually following the treatment recommendations. Less than 20% of diabetes patients actually follow the treatment plan. And coming back to what I said originally about being a diabetic, it's really about sticking to the plan that is a challenge. It's not just about going to the fridge and choosing whatever you have in the fridge. You have to really think about what it is that actually challenges you in that sense. And also it's important to keep in mind that the patients really have the diabetes as a primary cause, but the complications of not adhering to the treatment is really the biggest challenge. First of all, dialysis, amputations, nerve damages, eye impairments, and so forth. And from a cost perspective, over 90% of the life cycle cost is actually related to the non-adherence to the treatment. So we developed the Actis device and the Actis diabetes management as a service, reducing the number of steps that is required to actually treat your diabetes by 67%, so that you can just bring along whatever you have into your pocket rather than having a big case with a lot of stuff in it. And it's really about trying to optimize the service into a continuous self-improving loop and helping the patient stay on track. So simplifying the services, sharing the data, and being able to improve the services for yourself as well as for the healthcare services. We've been around for a little while, but in 2019 and 2020 is really where we got our breakthroughs with the ISO 13485 for development, manufacturing, and marketing of medical devices, and then 2 CE marks for the Actiste, and then in 2020 also for the Actiste Mini, which is beyond insulin-treated diabetes. And then we also just recently received the market approval in Saudi Arabia and in the UAE. What we've done, as you see here, we've really focused on the markets that have large number of diabetics with a high growth rates. So beyond Europe, it's really the GCC as well as the Southeast Asian markets. That is an important point for us to go through. And into the future, obviously, it's important to look at what is a data-driven approach to sharing data. Well, first of all, we have 25 patents that have been approved around the Actiste and the service, and another 38 pending. So we're a very highly intellectual property-driven company as well. But we see that the data that we can collect in terms of correlated data from the Actiste device and from the service can also generate a lot of opportunities. Coming back to one of the startups here, we're talking about clinical research, for example, to have reliable real-world evidence data to come into those processes, but also the opportunity of licensing out the portfolio as well. And obviously R&D for new product launches as well. So coming back, really putting yourself in a position, how can we help people with diabetes around the world? That is what Actiste and Brighter wants to do going forward. Thank you.
Thank you, Henrik.
Henrik, great to see you again. I've got a question about the team. I don't see any information there. Do you mind to share that with us?
Yes, so we are a team right now of roughly 50 people, based in Sweden primarily, but also in Estonia, Switzerland, GCC, Southeast Asia. We have a highly competent team for development, but also we have third-party production through Sanmina in northern Sweden, and also being able to scale that on a global scale so that we can localize and really get out fast into the market.
How about the units of the team, the other team members, their background, how they fit into the big picture?
How do you mean? I didn't quite.
The individuals, yeah, the names, the faces.
Okay, sorry about that. Yes, so the founder is Truls Sjöstedt. He's, as I mentioned, his wife is a diabetic. He's a technology nerd, as he calls himself, and he was the inventor of the platform. And then we've recruited top-notch people such as Jonas Johansson as the head of development, coming from the medical device industry, both on the software and the hardware side. We have a full team of developers in that sense. We have Dragan Zradkovic, who is our chief medical officer, coming from Sanofi and 20 years in that industry of the pharma industry. So we feel quite confident in that field.
Any startup background within the team?
Well, the founder himself, absolutely. But we're already a listed company in Stockholm, although we are pre-revenue. The Swedish market is quite different from the international market. So we've been listed since 2012.
So you have a wide range of investors.
Yes, we have 12,000 investors.
I'm saying, what can this group do for you? You don't seem like you need money. You seem like you need help in other areas. Where do you need help?
Well, I think that, I mean, we're just going to market. We actually started developing the Actiste in 2015 after canceling one launch that we did. And so this is the first real market introduction. We've raised $65 million roughly to date, and we're right now into the commercialization phase. So as we obviously we are on a continuous fundraising process in that sense. But as we are publicly listed, that's a different story. But what I think is really important for us is to really get into the commercialization phase in the GCC, particularly, and Southeast Asia. That's the first step.
Okay. Well, get a hold of me for the GCC market. I can certainly help you there.
Thank you so much.
Thank you very much. And now we have our dear judges, please check your evaluation of the startups, because in just 1 or 2 minutes we will announce the results. So you can look at the startups again and maybe reconsider something, maybe not, maybe just check. And I'm excited to pass the word to Anna in the meantime.
Thank you, Marina. It was great pitches, startups, and now we will have a small talk with our judges. But before we do, we have a special announcement. Alexander, floor is yours.
Thank you very much. And yes, usually we invite the winner of every unicorn battle to our VC House Club, and so we can talk with the winner more. When I say we, I mean that it is VCs from different countries of the world. So you're welcome. And if you are VC and you are still not a part of our community, please join us. We'll be glad to see you with us. Thank you, Anna.
Thank you, Alexander. And now, dear judges, besides finishing voting to startups, please dedicate 1 minute to do a special poll for us. We do like different polls in different parts of the world. It helps us to understand what is happening in the venture capital with the startups. This time you have multiple choice. Please choose what makes you think that the startups you meet for the first time, or you hear them pitching for the first time, you understand that that is it. It will be a future unicorn. It will be a game changer. They will disrupt the whole world, the industry, whatever. Just choose whatever is relevant and push submit. And we will talk about it some more during the networking session. And our girls are wrapping up votes. Please wink at me if you know who the winner is. If not, I have some more interesting facts to tell to our judges. We will have only 2 more events to go. We will be in South America on Thursday, and we will be in North America on Tuesday, and that is it. Next Friday, November 20th, is finals. Everybody is welcome to join us for this great event. It will be the whole day event. We will start with the sun rising over Japan, go with the sun all over the world, and end it when the sun will be over California. So you can log in any times. Here is startups pitching live, the best startups, and one startup that will represent HealthTech Europe will pitch their live as well. And I'm really looking forward to know who that will be. Marina, do you know already? Yes, Alexandra, you want to say something?
Yes.
Can we have some more time, please?
I just wanted to ask you, Anna, you said that we will see the sunrise in California, but I'm not sure. There are so much smoke these times in California that probably it's impossible.
I will show you.
No, we have technology, Alexander. We can make it. We can make it happen. You know, it's relatively easy to do so. For example, if you if you look at what we're doing right now, we've cleared the air, we're planting trees, and so forth and so forth. Come to California, bring your money, spend your tourism money here. Come to California.
Okay, and by the way, who knows what tomorrow can bring? So maybe we will have the sunrise. I'm optimistic.
So on the voting, what are the rules for recounting, for absentee votes, for mail-in votes? Is there any special conditions on voting?
You mean here on our battle? Yeah, you can send your votes by mail.
That was a joke.
That was a joke. I know, yeah.
And we will count them in a week, yes.
Okay, so
everybody voting is legal. Everybody is a legit legal judge. We confirm that.
Absolutely. We don't take people who do not look like experts and not grown up enough to vote and evaluate the startups.
Actually, Jordan, I'm not so sure that you're real. We see you all the time, but you could be Donald Trump in disguise. Who knows?
I could be dead. Who knows?
We will know it at finals. Everything will be finalized at finals, right? Okay, Marina.
Okay, so I'm excited to announce the results because our startups are waiting to find out who won today. And number 3 today goes to Searchmark. Hi, Evelina, congratulations.
Wonderful. That is really great.
Thank you very much, guys. I just have my buddy here who is helping me.
Hey,
great.
Best support.
Congratulations again, and thanks
Thank
for
you.
coming. And number 2 for today is Ancora AI. Congratulations.
Whoa, wonderful.
Thanks, everyone.
Well
Great.
done.
Thank you so much. And before we have startup number 1, I would like to do this.
Okay. Oh.
Yeah, and the winner is the last one. The last one is the lucky one, Brighter.
Wonderful.
Okay.
Thank you, everyone. What an honor. I'm thrilled. Thank you.
So see you at the finals.
Yes, next week on the 20th. Thank you so
Yes.
much. I'm really honored. I'm touched.
Get ready. It will be a great event. We already know who all the winners are, who will pitch. We will still be looking for General Battle North America and General Battle South America. Okay, but before that, let's talk a little bit. Can we have the poll results published? Look what our judges chose, right? People are in the team. Okay. The idea is just great and their results are speaking for themselves. Okay, so it's a mix of people, idea, and the performance, right? No surprises for us. But still, how do you know that the right people, like, for example, right now, the world is all online. What do you have like special features to know that you see the right people when you speak to them? It's easy maybe to evaluate a person when you're speaking face to face, but right now when you're in the Zoom or Google Meeting or having online call in some other platform, how do you evaluate that this is the right person for the idea he's promoting? Yeah, Tom, go ahead.
Part of it is how well the person answers questions. Anybody can give a pitch, and it's really hard because the questions are often quite difficult. So I think that's a big part of it.
Okay. Thanks for telling that. Yes, Sergey?
Well, I think the important thing is to see professional diversity in the team. So like every team member sort of complements each other, not like completely complements each other, but really cover the different areas. If we speak about health tech, it's great to have all doctors team, but what is also great, right, is to see a startup experience, to see a business development experience, to see a go-to-market experience, and to see a technical expertise.
Okay, so you mean if people in the team previously had performed greatly in some other startups, like where in a unicorn or where like famous people in their field, it's a great plus. It's
exactly. And if they took the right advisors, for example, if they don't have enough experience in some area, yeah.
Okay, great, wonderful. Okay, Alexander.
Probably it's easy sometimes to evaluate if you see at education and experience which you have in the past.
Education is still matters in our world? I don't know. We have lots of people like Steve Jobs. Like he was not the really great person with a great diploma. He was a great person, but not with a great diploma. Yeah, I must say. But...
No, he had diploma in the end.
Okay, my fault.
As I remember, they just gave him diploma.
Okay. Yeah, but still, like how does education plays a great role? Like, for example, in startup, when you're evaluating a team in the startup, does it matter if they all were from Harvard or they were well from some JC, like junior
Maybe
college?
It's not about just education, but about the network which you acquire from this education, you know, from the university you studied.
Education is essential,
right.
100% essential. Steve Jobs and all these guys, these are just corner cases. These are not how we run the world. Education, the better the college, the more impressive and the more likelihood you will be successful. Doesn't mean you're smarter, but the foundation is essential, the network is essential. And usually when you do the statistics, higher education, better education produces higher results. It's not required, but it's more likely.
Can I have this in text, Jordan? Because I need to show it to my kids. We have discussion in our family. Do we really need to go to school?
We can do a Zoom call when you want to.
You will help me out. Yeah, Gary, you were saying that Alexander was right?
The situation is, you know, the history, what you've accomplished, if you've had success, that's important. Of course, the university is important. I mean, I have one of our portfolio company has a Stanford MBA running it. And I know directly because I talked to a lot of the folks, and it definitely opens up the door when you said she has her degree from Stanford or MBA from Stanford, undergraduate degree in engineering. It's amazing, actually. So it helps. It gets you in the door, but it doesn't mean you're going to win. It does get you in the door. And then if you use your Stanford network or your Harvard or MIGIMO or Kiev University, I mean, use it wisely. It's all about networking. It's a network effect, but it does give you credibility coming in for sure.
Okay.
But for those who are listening and you don't have a Stanford or Harvard degree, it doesn't mean you have to have it. If you have it, it's an improvement on the status quo. But if you don't have it, you still have the ability to do this. Thousands of non-Stanford, non-Harvard, non-Yale grads have been super successful in building businesses. It's just another item that just makes you a bit more likely to succeed.
Yeah, Tom,
right,
you wanted to say something?
Yeah,
thank you.
They check the boxes, right? But I mean, the thing is, you know, it's not about the key to being successful. And I've seen thousands of companies through our accelerator and you know, personally been involved with 16 and 2 unicorns. I've seen it. And it's about the grit. It's about the determination. I think Marina was saying about being optimistic. It's about the optimism. It's about believing in your dreams. And, you know, just with Eva, I mean, we had 3 times we had to pivot with David Yang, and he's a billionaire. And I had to go down through, and it wasn't fun. We had to go out and interview people on the streets as founders of the company. And here you got a billionaire walking around with you, but that's the stuff that needs done. That's grit. And the difference is, are you willing, you know, it's not about failing. It's about, but in Russian, rasvorot, you know, making a U-turn and changing the direction. So you have to have people that are willing to do that and don't give up, because people that give up aren't going to succeed doing a startup for real.
I think that's the numbers. So that's where the numbers come, right?
Yeah,
the people, they don't give up. They have numbers eventually.
And I mean, look, I know people that have gone bankrupt that have come back and dominated the market, bankrupt. Personally know them. And this thing is, how do they do it? They started with nothing and they came back up again. It's because they got the right determination. And as Alexander said, the network. I mean, it's like, here we are at Unicorn Cup and Startup Network. I mean, think about it. It's a network of all the people you know. And just like Jordan's on, I mean, I know a lot of the people on the call today. It's about the trust that you develop. It's about knowing they're going to give you good deals and the relationship you develop. And especially today during the digital transformation, right? Because we don't have those in-person meetings like we did a year ago. It's a whole different world today.
Absolutely. Yes, Tom. Yep, you can go ahead. Unmute yourself.
First, I have a Stanford PhD, and that doesn't make me smarter or better than anybody else on the call. There are two ways in which Founders X Ventures thinks about education. One is that, for example, if somebody's at MIT or Cal Berkeley or Stanford or, name it, Oxford, Cambridge, name it, part of it is who are they doing research with? So if it's a PhD alum and we know he or she has been working with someone that we know is doing breakthrough research at a university, we say great. Because you can also check with the other people who are fellow PhD students or who were a fellow MD student or were the faculty member that the person studied under to find out two things. One, are they as good as they say they are? And two, are they an asshole, right? Because what you can't tell based on university pedigree is whether the person's a jerk or not. And that could be, I mean, Trump went to Penn, right? So there are outliers. So I think that in a sense, all of the people who are arguing this university thing are right. But it's not, and as all of you, I think, have agreed, it's not the only thing, but it's a really important thing to see, okay, if they went there, what did they do there? Who did they know there? Who did they work with there? How can we vouch, if you will, for the credibility of this founder based on people who spent a long time with him or her in the trenches?
Thank you, Tom. I didn't want to put this question in the poll, but still, does the gender matters? Lisa, maybe you can tell me. Does it matter if the founder is a woman or a man?
Well, you know, I'm a signatory to the $1 billion fund for women, so I'm a little bit biased on this topic, Anna. I think women are largely underrepresented as founders, right? And they certainly only get 2% of the capital. So we look for cognitively diverse teams, and we positively screen in women and ensure that they're asked the right questions at the table, because as you know, history says that women are often asked the risk questions, whereas men are often asked the revenue questions. We've got this joke in the SheVC network here in Asia. When you ask a man his revenue, divide it by 10. And when you ask a woman her revenue, times it by 10. It's a joke, but you get my drift. So, you know, I would encourage all of the investors on this call to consider signing up to Beyond the Billion. We've rallied 2 billion euros or US dollars, sorry, now in capital. And we need to change the paradigm. Please help us do it.
Thank you, Lisa. I totally support you. Count me in. Also, I would like to hear the views. We have heard mainly Tom, Gary, and Jordan, but they're from United States. Europe, please support me. What do you think?
Okay,
How do you? Yeah. Hi, Bas.
Yeah, thanks, Anna. Well, yeah, being from Europe, I've done some retrospective because I've invested in 24 companies so far, and there's nobody that has a PhD. In the new fund, we have 50% of founders women, and the best performers of those companies in the second fund are women. So we're very happy with that. I did know, I'm not sure, at some point, like for every good investor or every investor has a set of criteria. I think we can probably skip that part because they're all over the place. The 5 T's. We have an additional cash cow bomber methodology in which we assess with 24 questions what the growth hack potential is, which is good. You look under the bonnet before you invest. You understand already whether a startup is undervalued or not. So that is a pretty cool element. What I did notice is when you look at the few, we have a unicorn in the portfolio. We were their first investors, so we had great results. And that was a person where I believe that the ignition of the combustion engine, that is not a possible algorithm. That is only based on your own 20 years or something experience in the digital sector. You understand that you connect the dots and see some sort of product market fit, or you just see that the person is thinking in the right way. One important thing we noticed is if the founder is able to look from a helicopter at their own business and really even kind of foresee risks that a subjective biased founder would say, no, that would straight away get defensive or something, that is already a nice criteria. I've seen incredible devotion practically, that people couldn't stop talking about their projects. So you were there at 1 a.m. Okay, you know, we had our drinks, but yeah, they keep on going. And there's such energy and drive that sounds very generic, but those elements, they do invoke some sort of extra trust. And there is this very blitz or very quick interaction very often where you immediately catch each other in half a word. They're not always very, like in your last discussion about extroverts versus introverts, they're very rarely extroverts. The founder that is all of a sudden, like 4 years ago, he couldn't pay the rent. Now he is worth many, many hundreds of millions. And I still borrow him my bike in Amsterdam. He's casual as you can be. And I was on a call today with a guy he has $4 billion value in his startup and in Holland. That's another one. He's not in our portfolio, unfortunately. But I do notice that the practical, down-to-earth approach, that is really great. If somebody has a very smooth, very beautiful presentation, that actually starts making me almost a little bit careful, like a professional startup where everything is so neat. You've got the advisory board in order, the beautiful numbers, etc. That's the thing. One thing that I noticed where I missed out on a unicorn, where I could be the first investor, was that the valuation was just about 30% higher than I would normally feel comfortable investing. And that was a lesson that maybe it is sometimes good to not be too focused on that initial investment, because obviously if you are aiming for a unicorn, then it doesn't really matter whether you do 20 or 30. That's in a nutshell a handful. I could go on, but I'm very interested to hear other people's opinion.
Thank you, Bas, a lot. Actually, I have good news for you. I read recently in the pitch book that in year 2010, there were only 10 unicorns in Europe, but right now there are 53 of them. And this year is going to outperform all the previous years. So this is your time, dear VCs and private investors.
It's a lot of fun.
Absolutely.
And in there, if I may quickly add one thing, like if you look, there's this hidden potential that is not country related. If I talk about People AI, TransferWise, Revolut, Preply, Grammarly, Taxify, Bolt, WhatsApp, Skype, GitLab, and Google, and Miro, what is the thing connecting them? Russian-speaking founders. That's why we're searching for the unicorns in this region.
Okay, so that's alpha, that's specific alpha, like in the startup world, right? Like their cultural background. Yeah, we will, as I told you previously, we have only 2 big continents to explore, South Africa and North Africa this season. So please do not miss our upcoming unicorn battles. Girls, can we have a screen? Our event is wrapping up. Thank you all. You've been great. Thank you, startups, for great performance. Thank you, judges, for such an expertise and being such good friends of unicorn battles. Everybody is welcome, of course, to join us for the Unicorn Cup that is happening. Will be happening next week. Can you believe this? And this Thursday, Unicorn Battles AI in South America and HealthTech in North America. And don't miss it. I'll see you all there. Thank you, Marina. Great event as always.
Thanks for all the juries, guests, angels, startups. First of all, it was a pleasure today to have such a nice event. Hopefully everybody enjoys. And as Anna said, looking forward to see you at the finals soon, very soon. And any questions, please contact us about the jury or participation or anything, schedule, whatever.
Thank you and goodbye. Congratulations to the winner again.
Thank you.
Thank you so much.
Okay, take care.
Thank you.
Bye, everybody. Bye-bye.
Bye-bye.